Bismillahirrahmanirrahim. I am Dr. Shahlla Kamal working as consultant gynecologist in Tertiary Care Hospital. Today I am going to present an important office procedure, Pap Smear. What is Pap Smear? Pap Smear is a screening test to detect the pre-invasive disease of cervix. Where it should be taken? It should be taken from transformation zone. Transformation zone is the zone which, under the influence of the hormones in the whole life of the female, changes its position. And the columnar epithelium is replaced by the squamous epithelium, which is called squamous metaplasia. This transformation zone is the site where the cancer can be developed. So, why it is important to take the cervical smear or the pap smear? Because the pap smear is used for the early detection and management of the pre-invasive or precancerous diseases of the cervix for the prevention of cervical cancer. By this, we can decrease the incidence of the cervical cancer. So, why it is important? As I have already told you, so there are the certain screening programs for the cervical cancer. These screening programs are there should be no these screening program are from the age of 25 to till 64 years. Below the 25 years of age, there no screening of the cervical cancer is required. But between 25 to 49 years of age, every 3 yearly cervical smear or the pap smear should be done, and from 50 years to 65 years, 64 years, every 5 yearly the screening pap smear should be done. Along with in certain hospitals, HPV DNA screening has already been started with human papilloma virus, which is an important causative agent of the cervical cancer. Its screening schedule is between 25 to 64 years of age. It should be done 5 yearly. Or if it is done along with that of the pap smear as a co-test, it should also be done 5 yearly. Otherwise, the routine screening of 3 yearly between 25 to 49 and 40 between 50 to 64 years, it should be done 5 yearly. After 65, no screening is required if the female has the proper screening schedule, proper screening from the last 10 years with normal results, and there is no cervical intraepithelial neoplasia or any aggressive disease of the cervix in last 25 years. But if no screening has been done in her past life, or there is a certain cervical disease, it can be done or should be done after the 65 years of age as well. The sensitivity of the pap smear is around 58%. The specificity is around 80 to 100%. The risk of the cervical cancer can be reduced around 75 to 76% with the help of the pap smear, and with the vaccination, the risk of cervical cancer can be reduced around 70%. The false negative results are 26%. So it's a very important screening test that can prevent the cervical cancer and can help. So we have to do these screening programs at the mass level or at the community level in low middle income countries like Pakistan. So there are the certain prerequisites and certain contraindications. After fulfilling the prerequisite and ruling out the contraindication, you have to go for this pap smear test. What could be the prerequisite? Prerequisites are you have to introduce yourself to your patient and ask her about last date of menstrual period. The cervical smear should not be taken during the menstrual cycle. And after explaining all the pros and cons of the procedure, you have to take the verbal consent. And after that, you have to ask the patient to empty her bladder, lie in the dorsal position on the couch. There should be adequate light, proper privacy should be maintained, and there should be the glass slides, which are two glass slides, which are properly labeled with the name of the patient, with the MR number or the registration number, and other and they should be with that with these two slides, there should be some history document where the complaint, if there is any, it should be written there. After that, after fulfilling these prerequisites, you have to rule out the contraindication. What could be the contraindication? Contraindication would be there should be no cervicitis or vaginitis. If there is a vaginal discharge, you have to simple vaginal discharge. You have only the dry gauze to clean that cervix, so that, and there should be the minimal trauma to the cervix, and there should be no intercourse, vaginal douching, and the contraceptive cream used within the last 24 to 48 hours before performing this Pap smear. So it could be divided into the two parts. Like first is preparing the tray, and other is performing.